Hey everyone, it's Dr. Michelle here, and we have,
Dr. Carey.
and this is It Takes a Village, and we are so honored to be talking with pediatrician Dr. Natalie over at Whole Child Pediatrics. And we're hoping you could just start off by just introducing yourself, just tell us a little bit about your practice.
So everybody calls me Dr. Natalie, but my full name is Dr. Natalie Lambazian Drummond. So when you hear my whole name now, you understand why people just call me Dr. Natalie. Whole Child Pediatrics, I started Whole Child Pediatrics in 2012 when I just kind of got disenchanted with traditional pediatric practices and the kind of conveyor belt mentality that a lot of the administration was placing on us. And I just really felt like I really needed my autonomy so that I could practice the way that I wanted to practice. And I kind of veer towards patients who have complex medical problems. And so those usually do not lend themselves to efficiency and high number productivity. And so I decided I was going to jump out of that traditional setting. I was going to get additional training in different traditions of medicine and kind of create my own little place in the world.
I think that's awesome. And there's a lot of people that sing your praises because it is a different approach. And, we love working and co-caring, with you to help the kiddos. So, yeah.
What would you say sets you apart from other pediatricians in the area or in general?
Well, I would say, when I first came back here and started practicing, I didn't think I was that different. And part of it is because I trained on the East and West Coast where things are really, really different. Where I trained, chiropractors were on staff at the hospital. They came into our NICU. They would adjust babies. They consulted on cases. So when I moved back to the Midwest and there was this kind of, all the different traditions of medicine were really separate, I kind of didn't understand the environment. And after now being here 20 years, I've learned how the Midwest is very slow to accept change. But I think what sets us different, and it's not just myself, I also have two amazing nurse practitioners who I rely on all the time, is when people ask me what kind of medicine I practice, I say I practice medicine which is health by any means necessary. I've studied naturopathic medicine, I've studied homeopathy, I've studied integrative medicine with Dr. Weil. I did do some manual medicine training, and just, you guys, you have to have a gift, and I don't have that gift. But I learned, just at least understood its principles and kind of how it works and when it's appropriate and what best things are for certain conditions. And I would say that's kind of how I'm different, because I have a lot of families who are really looking for answers and are not getting them in a traditional medical model. And there's this almost like this shame, like they can't go to their provider and talk about, hey, I heard about castor oil packs to detoxify the liver. Is there anything to that? Or can I go, can I try these herbal remedies? And I want them to be able, and I want to, number one, understand the validity of those things and the safety too, because I want to make sure that we're not using things inappropriately and putting kids in harm's way. Because remember, that's our very first vow that we take as we become healers, is that we first will do no harm. And I just allow people to bring things to me. If I don't know something, I am happy to be educated and to go find an answer. And I'm lucky that over the course of my career, I've been able to make a lot of, connections with healers of all different traditions. And I can draw on them when I have a case that brings in something that I may not understand really well. So that's probably how I'm different. In my heart, I'm just an advocate. And I want kids to be able to live their best life. And if that means that, I'll tell you a quick story. When I came back here, it was standard of care on the East Coast that when you wrote a prescription for an antibiotic, that you would also advise the patient to take probiotic, which now, 20 years later, doesn't seem like it's that big of a deal. But when I first started practicing, I had one of the older physicians that was in my group come up to me and said, well, maybe we should just dance naked in the light of the moon too. And I was like,
wow.
I couldn't believe that. I'm like, I kind of looked at him and I'm like, this is not this is science. Like there's a growing body of evidence that looks at how probiotics can stop iatrogenic diarrhea. And yet he looked at it like witchcraft. So I always tell everybody, integrative medicine is not alternative medicine. I'm trained in alternative traditions, but I integrate them, which means I don't turn my back on my scientific mind. And I always look at efficacy. I want to see what data is out there. And then I lay out what options exist for a patient and then help them find out what is the best way for them and what are they most comfortable with. That's what integrative medicine is all about.
That's awesome. I think you hit it right on the head saying that you're an advocate, because that means you are working as part of a team with these families, and you're not just saying, well, you have this going on, this is what, what the common standard is, so you're going to do the same thing that I would recommend for anyone else. And that's just, we can't with the kids, especially today.
And I was so taken aback when I came back here, because we in Virginia would routinely call on other traditions, other healers from other traditions, and say, listen, we have this case and it's just really not going well, and we're just trying to figure out what are other solutions. And so, we had midwives at the table, naturopaths at the table, chiropractors. We used to do conferences. We used to do care conferences for our kids, and it was
that sounds amazing.
I know. I just didn't understand when I moved back here that they didn't. Why wouldn't you want that? And I always kind of laugh, because some of my staunchest critics when I first came back here have become my biggest advocates, usually because somebody they love has been affected. And then they kind of pick up the phone and they say, can you please help? And of course, I'm like, because at the end of the day, we all just want kids to be healthy, right?
Yeah.
So
yeah, that's exactly right. Just everybody, we kind of stay in our own lanes. We each do something different, and combine everybody together, we're going to get the best health for that family and for that child, and there's no animosity or anything like that. It's just everybody working together.
Right. And how are we going to learn from each other and come up with new ideas and advance things if we're not sharing information? And I think that's the other thing too, that was coming from an environment that was very collaborative, and then coming back to the Midwest where it was very divisive. I think that's dangerous, because there are people that will then enter realms where they shouldn't enter, and that's something that I really don't like see happening here. Like I have no problem. Like when I first started, there was a chiropractor that I worked with in Aurora when I was working in downtown Aurora, and one of the first ways that I incorporated chiropractic into my office was with my chronically constipated children. Because they get all full of stool, and then they cause all these subluxations, they get more peristalsis. And I didn't want to use Miralax, and I didn't want to put him on all these laxatives all the time. And I called him, and at first when I called him, he was kind of like, are you kidding? Like, are you setting me up for something? And I was like, no, like I'm really asking you for some help. And so I started sending him some of my patients, especially my younger ones. And he called me and he was joking. He said, I'm going to send you a plumbing bill because they all poop by the time after I adjust them, they're clogging my toilet. And parents just saw that, that's what's great about kids is you can see immediate benefit for a lot of traditions, because the pathology has not been ingrained for a long time. So you can really see how things can turn around. And I'm not a patient person. That's why I think working with adults would be frustrating for me, because I like to see immediate results. And so when you can send somebody who may never have considered a therapy, and then they try it and they see such dramatic results, they're like, wow. And then they're like, well, what else can this be useful for? And that's kind of how I started building my relationships with a lot of chiropractors and naturopaths and acupuncturists in the community. And it's been really great, not only just to meet colleagues that are always just committed to making people feel better, but also for my patients, who I'm sure would definitely say that they've been able to reverse conditions very quickly by drawing on lots of very intelligent healers.
Yeah. On that note, you mentioned you have a lot of patients that come in with plumbing problems. What do you tend to see in your practice? Is there anything that, kind of stands out with what you work with a lot?
Well, I think, we still see a lot of the bread and butter pediatric things, like we do the well child visits and development. And I'll be honest, at this point, my nurse practitioners are doing a lot more of the bread and butter pediatrics, because as our medical system continues to implode on itself, kids with complex medical conditions are just they're falling through the cracks. So I've kind of taken on more of a role to deal with the complex medical child, the ones who have chronic conditions, autism, mental health issues, that were born premature, neurological issues, ADHD. So I still have to do my regular bread and butter pediatrics. I call them my palate cleansers, so that I can just kind of keep myself balanced. But I would say the majority of my time right now is really focused on complex medical, and the nurse practitioners are doing a lot more of the standard bread and butter pediatrics.
Okay.
So I would love to say that there was one particular thing that I was seeing, but if I were to look at trends in the last 5 years, I would say more and more of my time is being taken up by mental health issues than ever before. And we are in a major mental health crisis with our kids. There's so much to discuss on that. Mm-hmm. But our philosophy is that it's mind, body, and spirit. And although we want you to have a healthy body, we want you to have a healthy mind and spirit. And those two areas are really taking a hit over the last 5 to 10 years in pediatrics.
It's heartbreaking, because you're definitely seeing it in much younger kids. Yes. Stuff we never would have thought we would have seen. And it's part of it. It's just like, how are we entering the world? How is the prenatal period, preconception period? I mean, these kids are wired for stress right when they enter the world. And then we wonder why things aren't performing and functioning and developing, well. So it is important that not only do families not feel like they're on an island, but like the practitioners, that's why we're doing this series, because we all can learn from each other, and we're not going to be experts in everything. So we need each other to lean on, and these families need to know about the tribe in this community that can help them get to where they want to go.
I think probably one of the best things that I tell my patients when they're going and looking for more people to add to their care team is when a practitioner says, I will do anything I can to try and help you, but I am not very versed in that area, and they are humble enough to say that this is something that they don't know about, those are the people you want to hold on to forever. Because, like I said, there's a lot of arrogance out there sometimes, and I've seen a lot of people have delays in care and get inappropriate care because their doctor didn't want to admit that this was not something that they felt like they could really help. And that's the freedom of integrative medicine. Is like, I have no problem saying this is not something that I feel like traditions of medicine I'm trained in is going to be very helpful for, but I know somebody, and I will send them. And it's amazing. Like the network that I have built over the years, they now all, like, we all know each other. We all talk to each other. We have an online Google group, and we've really been able to kind of cut down the time that people suffer with conditions. So I love my village. I love my village, and I won't give it up, even though sometimes practicing in Illinois is a challenge, but I love the village that we have. So.
Yeah. Wow, this has been great. I don't know if there's any parting things, or just like, what do you want, let's say a new family moving to Illinois and they're looking for a pediatrician, what do you want them to know when they are choosing one? How do they know that, what to find out about as far as finding an advocate?
Well, I'm going to just bring it up. I'm going to talk about the elephant in the room that you had mentioned before we went on the air. Illinois right now is really struggling with issues related to parent choice and vaccinations. And people need to understand that the majority of doctors here in Illinois are employed. which means that they don't get the freedom to practice the way that they want. So there are a lot of people that have turned their back on a traditional allopathic community because they were discharged from a practice because they didn't vaccinate, or they didn't want to vaccinate on at a traditional schedule. And I always tell people, I'm like, please don't be angry at them. A lot of times they had no choice in the matter, and they're grieving the loss of these patients, because particularly in pediatrics, we become really, really close because we see you guys so often. So please don't feel like you were abandoned if you were discharged from practice where a doctor said that you had to do it their way. That's the danger of being employed. Vaccine, just like anything, I tell everybody, I'm like, everything has risk associated with it. Benadryl, which is what we give for allergic reactions, you can have an allergic reaction to what we give you for allergic reactions. Everybody's different. And for me, it's not an issue. Like, you could debate safety in vaccines and efficacy and all that for days. In fact, when I was in Washington, D.C., that's what we did. And for me, it's not even about that. It's about, a parent or an individual has the right to analyze any medical treatment and weigh the pros and the cons and decide what things they want to do with their body, period. And I know people like to say things like, this is a public health issue and things like that. And there's, oh my goodness, I've been involved in so many debates. But at the end of the day, my concern is when we start passing policy that violates the sanctity of a person's body, where does that end? And so I tell everybody, I'm not anti-vax, I'm pro-safety, and I'm pro-individual choice and health freedom. And so I see being involved in this debate and the political environment in the state for the last 20 years on this issue. I'm seeing that people are getting more angry and driven by emotion and less by logic. And there are more bridges being blown up than bridges being built. And that scares me. And I don't think that's a good thing for our state. So I know you wanted to kind of touch on that a little bit.
Yeah, so, and I think the families are going to appreciate that as well, because some are they're stressed out about what to do. They don't want to go at this journey in their kids' health alone. And so I completely agree.
Yeah, there have been one of the cases that I testified when I went to talk to Congress was, families who really felt discriminated against because they didn't want to vaccinate, and they had been lost to medical care for years. And in pediatrics, those well child visits are so important. We're looking at so many different things that you may not be aware of. And my heart broke because I saw a 10-year-old boy who had not been seen by a provider, any type of provider, for 10 years. And when I finally saw him, he had bilateral undescended testicles. And something that I could have easily picked up on if I would have seen him in infancy. But because 10 years had passed, there was no way that we could reverse the condition. And it was all because his mom had a really negative encounter with a doctor who didn't respect her choice. And so, even no matter what position you take, you and your child and your family, they have a right to have access to medical care, whether it be a naturopath, a chiropractor, a traditional physician, whatever. But there are so many things that we are all looking at. So please don't just look at
Yeah, well said. Well said. Yeah, thank you so much for your time.
Thanks for being on today.
Yeah, no, thanks for having me. I really appreciate you guys, and I appreciate all that you do for my patients. So thank you so much.
Yes, same. Thank you.
Thank you.